Hello, this is Amanda Donlin from the Iowa Healthcare Collaborative. Thank you for joining us for episode 3 of our Just Culture podcast series. I am joined today by Carrie Shippers, Director of Patient Care Services, and Shauna Forst, Performance Excellence, Quality and Risk Coordinator for Mercy One Newton Medical Center in Newton, Iowa. Thank you for joining me today. First question for the day. Tell me about your working relationship. How have you developed this relationship, and what advice would you give others?
Well, I would say organizationally, quality reports to our nursing department. That then reports on up to our board of directors. Really, how we've developed our relationship, I feel, is just working through the day-to-day work and working through the quality trends that we see. So, yeah, we've just learned to communicate well, check in with each other, look for understanding. Advice that I would give others is always to have positive assumption and seek clarification. Many times in an organization, you get a bit of bad information or the data doesn't look great. And rather than assume negative, you want to assume positive. Maybe somebody doesn't understand. Maybe somebody thought they understood, but needs to be, the standard work needs reviewed. Or things change, rules change, the numerator denominators change. That's got to be constantly updated and shared and understood. Positive assumption is very important. Then seeking clarification. So if you don't understand the ask or you don't understand the data, and this is both ways, this is not just quality to nursing, it's also nursing to quality. And I think our facility does this well, where we're always trying to look at it objectively and work through it as a team.
Great, thank you. Carrie, can you tell me how you have developed a collaborative relationship between quality and nursing?
Yeah, I feel that we've done a really great job here in Newton with our quality department and nursing with collaboration. One of our quality team members is one of a nurse who works in many of the departments, and just really building that rapport with each other, I feel like helps build that relationship where a lot of times maybe as a bedside nurse, you envision quality being the people who are auditing you and looking at you for doing things wrong. But at the end of the day, the quality department is there to make sure we're doing things correctly to better the quality of care for our patients and make our hospital known for top care.
Carrie, I think that's a great point. I can remember early in my nursing career, prior to being a quality person, that I always felt like, yeah, they were watching us. So I think it's great that you have staff that can work both sides of the data.
Mm-hmm. Yeah, I think it's great. That person can also help explain why are we auditing what we are, or why are we measured the way we are on certain metrics? Because a lot of times, as a bedside nurse, you don't know those things. It's not something that we learn in nursing school completely. So knowing the why behind something helps get employees more on board with doing things the right way.
I would agree. When it comes to communicating, what are your top 3 tips for communicating clearly between the quality department and nursing?
Yeah, number one, like I just mentioned, would be explaining the why, having a background of why we're auditing what we are, what is the measure, and what are we being ranked on, whether that comes to 5-star ratings, etc. Prime example, we're kind of working on our ED decision to admit times and having a full understanding between the collaboration of ED, the house supervisors, and the inpatient staff of what does all that mean and how do we make our processes flow to decrease that wait time for patients. The second point I have is giving the team the real data, letting them know where are they at in the moment and what little steps they could take to improve that, and showing them those improvements always get a win from staff of making them feel like they are making an impact. And then my last third point is just communication overall, whether it's multiple communication platforms to employees, as not everybody checks emails all the time. Is it daily huddles with the team? Is it monthly meetings, posters on the wall, or screensavers on the computers that they're on? Just really putting that communication out there on multiple different platforms to get everybody engaged.
Yeah, I'd like to add that being an interpreter is a big part of my job in quality. And when you bring interdisciplinary team together, they're each looking at their section of the process. And, acronyms are different. Our focuses and priorities are different. What things mean are different. And so, being able to convert what nursing is saying and help finance understand their concern and the other way around. And then you bring an informaticist in and what they're looking at. And so just trying to help bridge those communication barriers, language barriers within all of the health literacy, not just one area and what they're doing, but all the different areas and how they work together. Just a comment back on building a collaborative relationship and nurses feeling like quality is always looking to get them. I think we've really tried to have an intentional focus and a strategy to make sure staff feel like that's not the case here. We've got their back and we're looking for the things that we need to grow in. And instead of writing up somebody because they've had this issue over and over, or we just haven't figured it out yet, or it's new information about something that's not working, it's what part of the process is not working. We have fabulous people working in nursing and in all of our care areas and our physicians and our lab techs, all of that. Usually, most all the time, it's not because of the person's aptitude or willingness. It's a process improvement thing. And so when you bring that interdisciplinary team together, they can each see where maybe this person sees the EMR one way and it looks differently to another, and they can sit side by side and look at that and be able to process improve in those areas to help make the data show what's truly happening. And most of the time we're being compliant and we're doing good work, good quality work, so that we're gonna support each other. It's not a gotcha, it's a team approach. And so we're looking for systematic issues, not people issues.
Shauna, that's a great point, that we're looking for those system improvements. And I'm excited to hear, I know the work you do, glad you shared it, that you use those interdisciplinary teams and that it is a group effort to make those process improvements. So Carrie and Shauna, how does that collaboration between your departments and other departments impact process improvement work and then create that just culture? I think we've heard a few points, but if you could, summarize that, that would be great.
Yeah, Amanda, I feel like when you have quality, it impacts multiple different departments. And if you have one department who is on board and the other department who maybe isn't on board for a multitude of reasons, you're not going to be able to move that needle on that metric without having everybody come to the table and be engaged in making that improvement. So ultimately, just having great leaders with us, Shauna and I, and how explaining that to these leaders who then take it to their frontline staff and come back as a process improvement opportunity to ultimately move those measures is how we're going to create our just culture. As Shauna kind of just mentioned, it's not a personnel problem anytime. It's usually an organizational opportunity that we have, and how can we as an organization come together to improve our care ultimately for our community.
Yeah, I agree with Carrie. Really working together on the objective things that we can all agree on. And that's usually put in the patient's perspective. If we're not meeting a metric, it's not a personal interest of any one person in this facility. It's in the interest of our patient. They're ultimately getting that care. And so when you can rally the teams around that, and I think it's important for people like Carrie's role, my role, maybe the radiology manager, whoever it is, those departments are coming together. If that leadership is committed to circling what's best for the patient and holding each other accountable, and we can disagree. Carrie and I can disagree on things and we can work through that and still have professional respect. And walking out of the door from that conversation, we're going to have a united front to fix and make clinical care the best that we can give it, because everybody wants that. Everybody has that goal when they come to work. So being able to do that, I think, is imperative.
I would agree. When leaders can show the just culture and the collaboration and the impact, they can share that impact that process improvements have had, it really does help draw in frontline staff.
I think a few other things too, a couple of items on process improvement specifically, is just really back to the basics. when I'm working with managers, we want to make sure like all of the required things like our quality improvement plans and our strategic key results and our employee goals, all of those things, they need to be very easy to read, that anybody that's looking at that document could explain it to somebody else. Sometimes the person reporting to the board isn't always the one doing the day-to-day data work. And so having documents and dashboards or whatever it is that works well in that facility, easy to read, easy to follow, that your board can understand, and that the person reporting it can feel confident in the information they're giving and be able to ask questions. It's something that we strive to do as well.
And I think that makes frontline staff and your board feel like they're more involved because they're capable of interpreting that data that you put in front of them. Maybe they had to miss the meeting, but they can still look at that and know what's happening and not feel left out of that process. If you had to tell other folks in hospital work, what are 2 steps you would encourage them to take in the development of a just culture, of a reporting culture?
Yeah, the first thing I would say as a quality professional is just fall back on your PDSA, right? Your plan, do, study, act. Where are you right now? What is your current state? And, be honest about that. Have honest conversations. And then where do you want to be? And talk about goals. Because from there you can decide what you can do in the first 3 months. What can you do in the first year? What can you do in the first few days? And what are your tactics and your action plan? And be able to see where you are and map out where you want to get. And I think those honest conversations and a commitment to the same goals can be 2 good first steps.
I would agree. Carrie, do you have anything to add?
I think we do a really good job, upon new hire orientation. That's where we instill that first day that those employees start in our organization, regardless of the department or position that they're in. We are instilling that just culture in everybody. So that way they know we're here to support them and we're all here for the same reason.
Great. Thank you both. Some key takeaways that I've gotten from you is that communicate, communicate, communicate. Make sure there's, multiple ways of communication, that your communication is easy to understand, that your leaders are communicating with one another on process improvement and showing staff how that just culture works when it comes to their interactions with each other. Anything else you'd like to add today?
Know each other's favorite snack.
Yes, that is so true. Okay. Well, I thank you both for your time today and sharing your processes for others to build their just culture in their facilities.